Tetanus and diphtheria are vaccine-preventable bacterial infections which are highly contagious. These infections can lead to severe respiratory complications due to the formation of a grayish membrane in the throat which can obstruct breathing and can result in death. The vaccines are responsible for the prevention of neonatal tetanus, which has led to hundreds of thousands of deaths globally according to the WHO. In 2011, Ghana was declared tetanus diphtheria free haven, having recorded less than 1 case per 1,000 deliveries annually. The tetanus vaccine is given during pregnancy, while the diphtheria vaccine is given to the baby after delivery. They are two very critical vaccines needed in maternal health care delivery. Hence, the public outcry when the country experienced a shortage of vaccines meant for routine immunization in February this year.
The fact that you don't have a disease does not mean that you should stop vaccinating. Because if you stop, then of course the disease rises again. And so we can't risk getting shortage of any vaccine at all. And that is why we make all the efforts to get vaccines when we don't have them.
TV3 visited the National Vaccine Cold Room at the Ghana Health Service, where the tetanus diphtheria vaccines are stocked. We are told Ghana has adequate stock of vaccines to last the country months ahead.
When we have vaccines produced in the country, first of all, we jump the hurdle of the importation fee itself. All the issues around handling and importation charges and so on will be a thing of the past, assuming that the vaccine cost itself in Ghana is much, much cheaper.
The recent outbreak of diphtheria in neighboring Nigeria, despite mass vaccination coverage, is a public health concern for the world at large. Cases have been reported in more than 16 states in Nigeria, increasing the vulnerability of children, and so Ghana cannot be complacent. A memorandum of understanding between the Atlantic Life Sciences and PT Biopharma, with supervision from the National Vaccine Institute here in Ghana, seeks to strengthen vaccine self-reliance in production to fulfill resilience of supply not only for Ghana, but also ECOWAS countries.
The vaccine is very, very important for the healthcare quality of the population. So that is why BAU Pharma from Indonesia is working with Atlantic Life Sciences in Ghana to be able to together working to develop and do the production in Ghana.
Health Minister Kweku Ajimanmenu is elated.
The idea of having shortages, the pricing will be better for us, will be a matter of the past. But more importantly, we are going to produce what we use in our own country.
The last time Ghana recorded cases of tetanus or diphtheria was about a decade ago. Currently in neighboring Nigeria, there is an outbreak of the diphtheria disease, having recorded over 13,000 cases and 500 deaths. This means as a country, we cannot afford to have shortage of this critical vaccine needed for maternal health care. Sarah Apenko, TV3 News, Accra.